Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician here in Hickory, North Carolina at Hickory Spine, and today I want to talk to you about who pays for auto injury therapy. So a lot of times when you're in an auto accident, if you've sustained damage to your muscles, to your ligaments, to your nerves, then you need some type of rehabilitative therapy so that you don't heal back wrong. And what we do in our clinic is we work with a lot of people that have these injuries, and a lot of times people are concerned about who's going to pay for it. So here's the thing. Ultimately you are always responsible for payment of your care. Okay, that's ultimately you are. But when you're in this type of, when you've been injured, there are usually a few people that will assist you or that will pay for your care. And in most cases, care that is necessary will be paid for by the person's insurance that hit you. Okay, so if it was someone else's fault, their insurance will usually pay for your care. And most of the time they will cover the care fully and there's no problems at all. Second, you may have insurance that's called medical payments. And if you look at your policy, you should have a medical payments clause on there, and there will be an amount of money that you can use to help pay for your care if need be. And it is usually in increments. It's either, the minimum we usually see is about $1,000 up to $10,000. My personal policy, and it's only a few dollars extra per month, and it's really, really helpful. I think my policy has $10,000 as medical payments, because if I'm hurt, you can use that money immediately to help pay bills. And that's really important, because sometimes when you're in an auto accident, you don't always have cash available to pay co-pays if you need, co-payments. And what will happen is once you go, 30 days, you start receiving notices that the bill needs to be paid. Once you go 60, 90, they'll send you to collections. So the medical payments can assist you with making those payments, quickly. So the person that hits you, if they have insurance, and hopefully they do, their insurance will typically pay for your care. Your medical payments can also assist with that at the same time. If the person does not have insurance, and this is happening more and more, if you're hit by an uninsured motorist, then your medical payments will help you, but you have a clause on your insurance called underinsured motorist policy, and it might be a slightly different name, but that is a part of your insurance that if someone hits you without insurance, it will, if the criteria are met, it will kick in and it will start paying. Now, here's the important thing: most people have only $25,000. If you have not looked at this, most people only have $25,000 in that policy. Listen, I highly, highly recommend, and it's only a few extra dollars per month, that you raise that to the maximum that's available. Minimum is $250,000, but you really need $500,000 in this uninsured motorist policy. Because think about this: if you're in a serious accident where you have to be hospitalized for a period of time, if you have serious injuries that require surgeries, you can go through $100,000, $200,000 in literally a few days. And that's, unfortunately, what happens if you don't have that underinsured motorist policy high enough. Well, what happens is you're responsible for those payments, and there's no one to pay for it. You can sue the person, but they may not have any assets to help you pay for it, and that process will take a long time while you're in financial ruins. So really, really important to understand is, number one, ultimately, you are personally responsible for any type of care that you receive. You need to understand, though, that in most cases, the person that hits you, their insurance will pay for it, and that's 99% of the time they pay for reasonable care. The next thing to understand is that you have a policy on your insurance that is often used at the very same time, called medical payments, that helps you to make payments on any kind of care that you receive, on a in a timely manner, because the person that hit you, their insurance will not pay a single penny until you have agreed to either settle the claim, or until it's been litigated in court and a determination has been made on what that insurance company's liability is. That can take years. So you've got to understand that medical payments and your insurance, you need that to be as high as possible. Your personal medical payments policy, so that you can pay for bills as they're incurred, and not have to wait on an insurance company to settle, because that's, quite frankly, I think that is it is the nature of this type of medical legal environment. And unfortunately, it also makes people, I've seen it happen when they're injured and they're not better even at 3 months, but they're getting bills from hospitals and these other people to pay the bills, or they're going to send them to collections. So the people don't want to end up with ruined credit, so they end up settling with that insurance carrier, the person that hit you. They settle and just to get the bills paid while they still are hurt and not fully recovered, and they no longer, and guess what, and once that settlement's made, you no longer have that insurance company will no longer pay for the care that you need. You've agreed that all liability is that the liability is, they're no longer liable for any of your future care. So it's a it's an unfortunate circumstance for a lot of people, but this is the reality of it. So you just want to be prepared as much as you can, and try to do the best that you can with the circumstances that you're presented with. One of the best things you can do is to raise your medical payments policy, raise your uninsured motorist significantly higher. Be a defensive driver the best you can, and try to just try to do the best that you can every day. I mean, it's sometimes we're hit with these circumstances, and we're unable to we're unable to change the outcomes and things that happen to us. It's out of our hands. Someone hits us, runs a red light, hits us. We would never seen it coming. There's nothing we could have done. You just you want to prepare for the worst and be prepared for anything like that occurs. So main take homes here, guys. Liability carriers typically pay for any type of care that you need. That happens in 99% of cases. You need to have your own insurance medical payments policy at least at $10,000. It only takes you a few more dollars per month, and that helps you to make immediate payments on any kind of care that you're receiving. Then you also need your uninsured motorist policy to be as high as you can get it. It's only a few extra dollars per month. And that should keep you covered. That should have you covered. Ultimately, remember though, whatever you incur as far as expenses go, or bills, that is something that you're ultimately responsible for if none of those methods of payment are available. So that's why I'm really having this conversation with you, so that you can make sure that you're insured, to the degree that you need to be. So anyway, I hope this helps you better understand who pays for auto injury therapy, and it helps you to prepare for these circumstances, because it's not a good scenario whenever you're stuck with bills and it was someone else's fault, and on top of that, it's just adding insult to injury, because a lot of people have permanent injuries from these types of accidents. So prepare the best you can so that it protects you financially, so that you can focus on just getting better. Okay, so anyway, I hope this helps you out. I hope you have a wonderful day. Just give us a call if you'd like my opinion on your injuries. I'll be happy to take a look at you and let you know what I think. If I don't think I can help you, then I will help you to find the appropriate specialist. Our phone number is 828-324-0800. You can also find us at hickoryspine.com to learn more. Thanks.